Good afternoon, everyone. My name is Aojaar Israel Ogwang. I'm a resident at Makere in my third year at the Department of Anesthesia. So I'm going to present my proposal with the title, Outcomes of Critically Ill Patients with Primary Acute Neurological Injury Admitted into Intensive Care Units in Uganda, and it may be a retrospective registry-based study. Those are my supervisors. So just for operational definition, I will be referring to primary acute neurological injury as a diagnosis involving the central nervous system, including the spinal cord injuries. And those can be traumatic or atraumatic. And they'll be very distinct from chronic neurological injuries, where you could think of Alzheimer's and ALS in that disease category. So within this disease category, you think of strokes, TB, traumatic brain injury. And on the infectious side, you could think of meningitis and encephalitis. And another important definition would be the SNOMED-CT, which is systemized nomenclature of medicine, which would just be basically universally accepted medical terminology for electronic data. So just a bit of background. The incidence of primary acute neurological injuries is high. One example would be for traumatic brain injury, where an estimate of about 69 million new cases occur annually. Stroke, for example, is the second leading cause, and its complications, second leading cause of death globally. And meningitis on the infectious end affects a lot of the pediatric population from 0 to 4. So it accounted for about 200,000 deaths in the year 2022. In sub-Saharan Africa, compared to the global incidence, here we have a much higher incidence of some of these conditions. For example, traumatic brain injury, with the global incidence being at 106 cases for 100,000, sub-Saharan Africa has about 3 times that number. So the incidence of many of these conditions is higher with the information that is available. And despite these high outcomes, with this high prevalence and incidence, the outcomes still remain poor. For example, one study noted that 86% of the deaths from stroke occur within low and middle income countries, including sub-Saharan Africa. And for traumatic brain injury, just to paint you a picture, if one sustained traumatic brain injury in a low middle income country, you'd have twice the odds of dying from that condition compared to a person who sustained such an injury in a high income country. And some of the potential drivers for many of these outcomes have been resource scarcity. So you can think about CT scans and lack of trained staffing, and the coexistence of certain comorbidities like HIV, which make this much worse for us. In Uganda particularly, the mortality does mirror what is abroad. What is seen with a wider part of low and middle income countries, with one study noting that about 46.9% would be the mortality, in hospital mortality when a patient sustained traumatic brain injury. For many of the patients, like we had seen previously, they do account for many of the patients we see in the hospital, but also account for a number of patients who are admitted into ICUs and are managed there. One study by Dr. Tumanya noted that about 34.5% had a diagnosis of altered mental status at admission. And again, from analysis mortality rate, you could see that the mortality rate was high, and it was comparative to that seen in other countries. So with the ICU, again, we've talked about how many of these studies are very sparse and few, and have really focused outside the ICU. So with the advent of the registry, like we have seen, this has cut across several ICUs within the country, both public and private, and captures a lot of these neurological injuries in the whole sum, not particularly disease specific. So my problem quickly would be that ideally patients should be seen in places that are capable of providing this neurocritical care, using protocols that are evidence-based. However, that does not exist because we do not have that data existent that cuts across the full spectrum of all these conditions. And many of the studies that we've had have been very specific to traumatic brain injury, and have also focused on a short-term period. And so that has not enabled adaptation of some of the guidelines that usually are made in higher income countries. And so for many of the countries planning in terms of like the National Development Plan that aims to reduce mortality from from non-communicable diseases, this might not be achieved if we continue with this trend. So my research question, among critically ill patients admitted into ICUs using this ICU registry, between the years 2022 and 2025, what are the ICU outcomes, which will be 28-day ICU mortality, ICU length of stay and ventilation time, and then how do outcomes, which I've stated, compare between traumatic and non-traumatic neurological injuries in ICUs, and what are the trends in the ICU outcomes over the course of 3 years that I've stated. Some of these the variables are listed here, what we'll be looking at, including the dependent and the independent variables. So basically, in summary, the expected outcome following my study. So this is what I hope will be the use of some of the data. Like we've talked about how many of the studies that are present have been very small, involving very few ICUs and over a short course period of time, but have not had the opportunity to have national coverage. And many of them, of the studies that exist right now, are very specific to traumatic brain injury. So a lot of the disease conditions that fall under that disease category have not been represented. And yet many of them do have specific unique pathophysiology and hence management plan. So using this data, we could be able to, one, for example, understand how to uniquely manage some of these patients, and also to adapt protocols that usually are made in high-income countries to a local context within Uganda. And besides, outside the clinical setting, it could also help policymakers with benchmarking as well as resource allocation for when this data is used. Thank you.